Before administering an oral medication, review the physician's order. Also, observe the first 5 rights of medication administration, and later address the 6th right, documentation, as shown in the video skill, Ensuring the 6 Rights of Medication Administration. Prepare drugs for one person at a time. Now obtain the correct drug from the automated dispensing system, or unit dose drawer, and compare the drug label with the MAR. If the dose printed on the container differs from the ordered dose, verify the correct amount to give and put the correct number of tablets or capsules into the medication cup. For unit dose tablets or capsules, put the packaged medication directly in the medication cup without removing the wrapper. If tablets and capsules will be given at the same time, use the same medication cup, except for drugs that require pre-administration assessments. For a patient with difficulty swallowing, crush the tablet with a pill crusher, if not contraindicated for the type of medication, such as long-acting, sustained release, or time-released. Then mix the crushed tablet in a small amount of soft food, such as applesauce. For a patient who needs half of a pre-scored tablet, break it at the center line with a pill cutter or your gloved fingers. Based on facility policy, discard the unused portion or return it to the original container. For any medication, check the expiration date. To prepare a liquid, gently shake the container. If the medication is in a multi-dose bottle, remove the cap. With the medication cup at eye level, pour the liquid to the prescribed level. If the liquid appears discolored or cloudy, discard it. Be sure to measure at the liquid's meniscus and not its edges. Make sure the cup remains level to get an accurate dose. Then wipe the lip and neck of the bottle with a paper towel and recap the bottle. If the prescribed dose is less than 5 milliliters, draw the liquid into a calibrated oral syringe. For any medication, check the expiration date. When you must prepare a controlled substance, such as an opioid, ensure that the drug dispensing system automatically tracks its removal. Now compare the MAR with the prepared drugs, reading their labels once again. Do not leave the drugs unattended.
Mr. McGee, everything looks good for you to have your medications. I'm going to get them ready for you.
To administer oral medications, perform pre-administration assessments, such as taking the pulse or blood pressure if necessary. Deliver medications to the patient at the correct time, and identify him according to facility policy. After explaining each medication's purpose and action, allow the patient to ask questions about the drugs.
I'm going to be giving you digoxin today for your heart. And a stool softener. Your prednisone and a cough medicine for your cough. Do you have any questions?
No, I understand what they're for.
With the patient in a seated or side-lying position, administer tablets or capsules with his preferred fluid. If desired, let him hold solid medications in his hand or a cup before placing them in his mouth. If a patient can't hold the drugs, place the medication cup or a spoon to her lips and gently place each drug in her mouth one at a time. Don't rush or force the medications. For a sublingual drug, have the patient place it under the tongue. For a buccal drug, have the patient place it against the mucous membranes of the cheek.
Mr. McGee, I have some medication for your chest pain, and it goes under your tongue. I'm going to have you open your mouth and lift your
With
tongue
either
and
type
drop
of
it
drug,
under your tongue.
instruct
Just
the patient to let it dissolve and warn against swallowing it.
Lift your tongue. Do not chew or swallow that. Just let it dissolve under your tongue.
Similarly, caution against chewing or swallowing a lozenge. To administer a powdered medication, mix it with liquid at the bedside and give it to the patient to drink. Administer an effervescent powder or tablet immediately after it dissolves.
Mrs. Greer, I'm going to give you some more medicine. Just go ahead and take a sip of that. Mr. McGee, can you open your mouth and show me that all of those pills
Stay
went
until
down?
the patient has completely swallowed each medication.
Okay, that looks
Ask
good.
him to open
You
his
want me to put
mouth
the head
if
of
you're
your
not
bed back
sure
down?
whether the drug has been swallowed.
Mr. McGee, I'm going to be giving you some medication in a little bit that might upset your stomach, so I'm going to give you some crackers to eat right now.
For a medication that should not be given on an empty stomach, offer a snack such as crackers if not contraindicated.
Mr. McGee, I've got a teaching sheet here that I'm going to be leaving with you. It's regarding the medications that we started you on.
As
while
part
you
of
were
your
in the
follow-up
hospital.
care, verify
Some
the
of
patient's
those
understanding
medications
of
are the
each
ones that I gave
medication's
you today,
use.
Digoxin, Colace, and your nitroglycerin.